Hi, good evening everyone. I am Alina.
I am Ardra.
Today we are going to discuss about the Nursing Foundation, 2 chapters, Unit 4 and Unit 7. Unit 4 is Communication and Nurse-Patient Relationship and the Unit 7 is Equipment and Linen.
The first one is Unit 4, Communication and Nurse-Patient Relationship. In this unit, explore how nurses explore how build a trust in a patient and how we can communicate with the patient in a positive way. And the main topics of the unit is communication, levels, elements and process, types, modes, factors influencing communication, methods of effective communication or therapeutic communication techniques, barriers to effective communication or non-therapeutic communication techniques, then professional communication, helping relationships including nurse-patient relationship in that purpose and phases, then communicating effectively with patient, families and team members. And last one, maintaining effective human relations and communication with vulnerable groups including children, women, physically and mentally challenged and elderly people. These are the main topic coming under the Unit 4, Communication and Nurse-Patient Relationship.
In that, our first topic is communication. So we can see what is communication. Communication is the process of exchanging of ideas, thoughts and feelings between two or more people. The communication means we are exchanging our ideas and thoughts between two or more peoples. And the next topic is levels of communication. What are the levels of communication? There are 4 levels of communication. First one intrapersonal, the second one interpersonal, third one groups and the fourth one is public. In that the first one is intrapersonal. Intrapersonal means communication within yourself. We can communicate with ourselves. The example is self-talking. And the second one is interpersonal. Interpersonal means one-to-one interaction. The example is nurse-patient or nursing colleges. In interpersonal, there is only 2 people are interacting each other. The third one is group. Group means communication in a small groups. We are communicating in a small groups. Examples are team meetings and support groups are the examples of groups. And the fourth one is public. Public means speaking to a large audience. We are speaking or we are communicating with a large audience. Example presentations, health task or we are taking the seminars. These are the examples of public communications. These are the 4 levels of communication. Then our next topic is elements of communication. The elements of the communication is first one sender. Sender means the person initiating the message. Sender means who all are taking the initiation of starting a message or starting a conversation. Next one message. Message means the information being conveyed. The message means the topic. What
Convey.
the topic is our taking for the communication is a message. The third one is channel. Channel means a medium. We are using one medium to communicate with each other. We are using in verbal language, written or in digital forms. It is considered as a channel. Then the fourth one is receiver. Receiver means the person receiving the message. Who the person is receiving the message, he is considered as a receiver. The fifth one is feedback. Feedback means the response or reaction. The sender sending a message to another one, they are receiving a message and they react or their response or reaction of that message is we termed as feedback.
Next one is process of communication. How the communication will process in between 2 peoples. And then first one is encoding. Encoding means sender formulates the message. In that one person is or one thing is there, that is called sender. The sender formulates the message. Then second one is transmission. Transmission through messages is sent via a channel, through a channel. Channel includes person, written, then seeing, TV, radio like things, etc. So the message is sent through the channel, that is transmission. Then third one is decoding. Decoding means receiver interprets the message. The the receiver will understand the message from the sender, that is decoding. The last one is response. Response means receiver react or provide feedback. The receiver understand the message and the receiver prepare the feedback and send back to the sender. That is response. These are the process of communication. Then types of communication. Mainly two types are there under coming types of communication. First one is verbal and second one is non-verbal communication. In verbal communication, they are using the words like spoken or written words. They are using in the verbal communication. Then next one is non-verbal. We are using body language, facial expressions, gesture. These three things we are using in the non-verbal communication. So these are the main types of communication, verbal and non-verbal.
Then the next one is modes of communication. Modes of communication is, first one is face-to-face communication. It means direct interactions. The example is we are example taken as interview. In interview we are interact with each other. The face-to-face is we are interacting with each other. Then the second one is phone. Phone is verbal communication. Phone is used for the verbal communication. We are using the phone. The next one is written. Written means reports, charts, letters. Through the reports, charts or letters, we are communicating with each other. Then the digital. Digital means email, text message and other apps are we are using for the communication or interacting with each other. These are the modes of communication. The next one is factors influencing communication. What are the factors that influences our communication or interactions? The first one is language. Second one is cultural differences. Third one is environment and distractions. And the fourth one is emotional state. Next one is physical and mental health. The next one is interpersonal dynamics. You just note the points of factors influencing communication. This question is asking for 2-mark questions in your exams.
Next one is methods of effective communication or therapeutic communication techniques. In under that, first one is active listening. In that, focus on the patient. It mainly focus on the patient, note and paraphrase. In that, the nurse should be focus on the patient and react to the patient to get a active listening from the patient. Then second one is empathy. Empathy means understand and acknowledge feelings. The nurse should be understand and to know the feelings of the patient from their conversation. Then open-ended questions like encourage patient to share more. The nurse should ask the open-ended questions towards the patient and encourage the patient to share more about their condition, and it helps the nurse to understand their situation. Then clarification. In that, the nurse should seek more information to understand clarity. Then reflection. Reflection means reflect emotions or words back. The patient showing their emotions or saying about their conditions. So the nurse should forward the emotions back and to explain and understand the conditions of the patient in a proper way and reflect the emotions or words towards the patient. That is reflection. Then summarization will come, recap main points. The nurse should recap the main points that the patient told to the nurse. So it will help to understand the patient condition more to the nurse. Then non-verbal cues, maintaining eye contact, gentle touch. In the conversation, the nurse should maintain a proper eye contact and to give a gentle touch to the patient in a to get a emotional connection. Then last one is silence. Allow patient to process thought. Give a time to the patient to process thoughts to get a proper conversation. These are the methods of effective communication or therapeutic communication techniques.
The next topic is barriers to effective communication or non-therapeutic communication techniques. So first one is psychological or emotional factors. It means the stress, anxiety, fear and low self-confidence are the barriers of psychological and emotional communications. Next one is physical. Physical means background noise or poor lighting or physical distances are included in the physical. The physical factors are influencing or it is against our effective communication. These are the barriers that affect our communications. The next one, language. Language means use of simple jargons and different language. Jargon means the professionals are using some languages that are difficult to understanding others. That means jargons, and different languages also affect our proper communication and all. The next one is cultural. Cultural means misunderstandings due to different norms, social status and non-verbal cues. The next one is cognitive or attitudinal factor. It means lack of attention, lack of interest. These factors are the barriers to effective communication or non-therapeutic communication techniques. So first one is psychological or emotional, second one is physical, third one is language, fourth one is cultural, and the fifth one is cognitive or attitudinal.
Next one is professional communication. The definition is professional communication is the exchange of information between individuals in a workplace or professional setting characterized by respect, clarity and effectiveness. The professional communication means it is a one type of communication. It happens in a workplace, professional workplace with two people who are working in a professional place with characterized by respect, clarity and effectiveness. That is known as professional communication. It happens in a professional workplace.
Professional settings also.
Professional settings also in a two working people. Then it use clear and conscious language, then respectful tone, active listening, appropriate body language, empathy and understanding, open-minded. So in this professional communication, we need to use clear and conscious language. We need to use a clear. The person need to understand our conversation, what we are telling. The other person need to understand, and we need to use a clear language. Then respectful tone. Then active listening. Then appropriate body language, empathy and understanding, open-minded. These are the things coming under the professional communication.
The next one is helping relationship, purposes and phases. For the first one is helping relationships. A helping relationship is a professional supportive interaction between the nurse and patient. It means helping relationship means it is occurs between the nurse and the patient. It is a professional relationship and a supportive interaction between the nurse and the patients, and it focuses on the patient physical and emotional well-being.
Promoting.
It is focused on we have to helping relationship. We have to provide for promoting the patient's physical and emotional well-being also. Then the purpose of helping relationship. The primary purpose is to support patients' physical and emotional needs. The main purpose means physical and emotional needs. To support the patient's physical and emotional need is the primary purpose of the helping relationship, and promote health and facilitate healing through trust and effective communication. These are the purposes of helping relationship.
Next one is communicating effectively with patient, families and team members. In that, first one is communicating with patients. How a nurse need to communicate with a patient. In that, first one is use simple language. If we are communicating with people, we need to use a simple language. Then it helps to understand the conversation easily to the patient. Then show empathy and understanding. We need to show the empathy towards the patient, and we need to understand the conversation. The patient need to understand the conversation. Then listen activity. Last one is validate their concern. We need to validate the patient's concern towards the activities we are going to do. Then next one is communicating with families. That first one is be clear and honest. If the nurse is communicating with the families, the nurse should be clear and honest with their communication. Then address concerns and emotions. Then involve them in care planning. If we are preparing a care planning, we need to involve them in the care planning. The last one is provide update regularly. These are the communicating with families, undercoming in the communicating effective with patient and families.
Next one is communicating with the team members. What are the things we understand for communicating with the team members? Be concise and specific. Concise means we are using don't use the difficult words or medical words to communicate. The word should be in a simple language. Be concise and specific. Use respectful tone. When we are communicating, we are communicating with a respectful tone only. Then share relevant information promptly. Share the relevant information and the important informations correctly within the team members. Then collaborate and clarify roles. And collaborate with each other and clarify all the doubts and all about the disease condition or what are the topic we are discussing each other. The next one is maintaining effective human relations and communication with vulnerable groups. First one is communicating with vulnerable group means like children, women, physically and mentally challenged individuals and elderly. We are considered as the vulnerable groups. And the elderly requires extra care for understanding. Communicating with the vulnerable groups like children, women in sensitive situations, physically and mentally challenged individuals and the elderly requires extra care and understanding.
In that first one, children. In children, we need to use simple age appropriate language. Then only the children will understand what we are telling. So we need to use simple and age appropriate language towards the children. Then speak at their level, make eye contact. By communicating with the children, we need to make eye contact with them and speak at their level. Then next one, use play or drawing to communicate. To play with them or draw to communicate easily to the children. It will help to understand what we are communicating with them. Then be patient and reassuring with the children. Second one is woman. Woman in examples in sensitive situations. We are communicating in sensitive situations. We using ensure privacy and comfort. We need to ensure a privacy and comfort to the woman to feel safe around us. Then listen actively, show empathy. We need to listen actively what the women are telling to us. We need to listen actively and we need to show empathy towards the person. Then respect culture, norms and boundaries. We need to respect their norms and the boundaries. We don't cross their boundaries. Then last one is involve them in decision making. What the decision we are making, we need to involve the patient or the woman to the decision making. These are the things coming under children and women.
The next one, physically challenged. Physically challenged means speak directly to them, not their caregivers. When we are communicating with the physically challenged people, we can directly communicate with them, not with the caregivers. The second one, for offer assistance but respect autonomy. We can offer the assistance for them for doing their needs and successful their needs, but respect their autonomy. Use clear and simple language. We are communicating with a clear language and a simple language only we can communicate. If we are using the jargons or other languages or the medical terms, they are difficult to understand. Next one, be patient with the response. Next one is mentally challenged. Mentally challenged people in that speak clearly, simply and slowly. When speaking with the mentally challenged people, we can speak clearly, simply and speak with them slowly only. Then use non-verbal cues. Non-verbal cues like gestures and touch if appropriate. Then validate their feelings, be empathetic. validate their feelings, and be empathetic with them. Next one is break informations to smaller chunks.
Next one is elderly. If we are communicating with the elderly people, we need to speak clearly, avoid jargon. Jargon means professional medical terms. We don't use don't use while communicating with the elderly people. They won't understand the communication way. So we need to use speak clearly and avoid the jargon way of communication. Then allow time to process information. If the elderly people, we are communicating with the elderly people, we need to give some time to them to process to understand and the process the information to them. Then respect their experiences and view. Last one is involve them in decisions if possible. What are the decisions we are taking? If possible, we need to involve them in the decision making.
Our next chapter is equipment and linen. In that chapter, we are going to discuss about the equipments we are using in the hospitals and the essential items we are using in the patient care, and the purpose of the equipments and the linen, and the how to maintain or how to function it, and how to handle the equipment. These are all the things we are going to discuss in these chapters. The topics are included in this chapter is the types of equipments, disposable and reusable, linen, rubber goods, glassware, metal, plastic, furniture. These types we are discussing in this chapter, and the introduction, intent, maintenance and inventory. These two topics are we are going to discuss in this chapter.
First one is equipment and linen management. How we manage the equipment and linen. In that, in healthcare settings, equipments and linen are crucial for patient care, and their management ensures safety, hygiene and efficiency. In the healthcare setting, equipments and linen are crucial for patient. Then the management ensure, mostly the management ensure the patient safety, hygiene and efficiency. We need to use hygienic items, and then only we can ensure the safety of the patient. Then next one, disposables. Disposables, first point, items used once then discarded to prevent cross infection and ensure sterility. If in this process we used one item, then we need to discard the items to prevent the cross infection. Otherwise we use again and again, the cross infection will
spread to others.
So we need to prevent the cross infection, and we should discard the used items to ensure the sterility. Then examples, gloves, syringe, mask, wound dressing and catheter tips. These are the items we need to discard after one use. Then benefits of this: convenience, reduced infection risk. By doing this discard, we need to we help to convince or reduce the infection risk.
The next one is reusable items. In reusable items, the first one is linen. Linen means it's a fabric, bed sheets, towels, patient gowns and pillowcases. These are we consider as linens, laundered and reused multiple times. This linen, like the bed sheets and towels, we can launder and reuse it to multiple times, and it requires regular washing, sterilization and maintenance. While reuse it, before that we are regular washing or sterilize the bed sheet, towels and patient gowns and all, and maintenance. Next one is rubber goods. Rubber goods means items like tubes, catheters and gloves are the rubber goods. Sterilized between use to prevent infection, and durable but need checking for wear and tear. Before using it again, check it for it is there any wear or tear is there or not, or sterilize before it using to prevent the infection or spreading of the infections.
Next one is glassware. Glassware includes containers, bottles and lab equipments. Then this sterilized using autoclaves or disinfection. What we are using to sterilize the glasswares? Autoclaves or disinfectants we are using to sterilize the glasswares. Then handle with care to avoid. Then handle with care to avoid breakage. We need to care the bottles do not to break. That is glassware. Then metal. Metal includes surgical instruments, equipments, parts. These are the things coming under the metals.
Right.
Then it sterilized using heat or chemicals. We using heat or chemicals to sterilize the metals.
Items.
Then regular maintenance prevents rust or damage. We need to maintain we need to do a regular maintenance to prevent the rust or damage to the metal items.
The next one is plastic items. Plastic items we are considering trays, containers and equipments we are used in the hospitals. Sterilize or disinfect depending on the type. Depending on the type of the plastic, we can sterilize or disinfect the equipment. Check for cracks or degradation before using. Check it is there any cracks or degradation is there or not. Next one is furnitures. Furnitures, we know what is furnitures. The types are beds, chairs, tables and in patient areas. These are the furnitures. Regularly disinfect, especially after patient use. After patient use, we disinfect or sterilize the furnitures and all before using to other patients. Durable and easy to clean materials preferred. We are preferring the materials that is durable and easy to clean.
Next one is introduction, indent, maintenance and inventory. In that first one is we are going to check the introduction. Introduction, effective management of equipment and linen is crucial in healthcare settings to ensure patient safety, comfort and efficient service delivery. This involves proper handling, maintenance and inventory control of various items. In that effective management of equipments like equipment and linen is a crucial healthcare settings. It is ensure the patient safety and comfort. This thing is ensuring the patient safety and comfort and efficient service delivery. This involves proper handling. It involves the proper handling, maintenance and inventory control of various items in the hospital settings. First one is indent. What is indent? Indent means a formal request or order for equipments. The indent means what? In a formal request or order for a equipment in the hospital. Equipment like linen or supplies needed for the patient care. If we need something for the patient care like equipment, linen or supplies, we need to request or order in the hospital setting. That is called indent. Then purpose of the indent ensures timely availability of necessary items, prevents shortage and manage resources efficiently. In that indent purpose means timely availability of the items we needed in the patient care, then prevent shortage of the items. Last one is manages resources efficiency. That is the purposes of indent. Then process of indents is departments submit indents based on needs. What are the things we needed for the patient care? So the department submit the indent for the process. Then central supply or store reviews and processor request. Last one is items issued and record update. What are the items we need? We need to issue the items and we should record the updates. What are the things
items are delivered
in the indent
ward or in the hospital settings
by the indent.
Next one, maintenance. Maintenance means purpose of maintenance is ensures equipment and linen remain functional, safe and hygienic. Ensure equipments and linen remain functional. Maintenance purpose is check it before delivery, it is functional, it is safe, or it is hygienic or not. Then the activities are regular cleaning, sterilization and disinfections. Regularly we clean the equipments and sterilize and disinfect the equipments and all. Repair or replace damaged items promptly. If any item is damaged or it is damaged, we can repair or replace it. Next one is schedule checks for complex equipments. Schedule the complex equipments we can check and schedule. And the linen laundering and storage as per norms. As per the norms, linen laundering and storage can be done.
Next one is inventory. What is inventory? Inventory means tracking and managing stock of equipment, linen and supplies. In this, we should track or manage in the stock of equipments like linen and supplies in the hospital settings. The importance of inventory is prevents overstocking or shortage of the items. If the hospital setting it overstocking or shortage, if one item is overstocking or shortage, it prevent it by using the inventory. We can prevent the overstocking or shortage. Then ensures items are available when needed. What are the items the hospital needed? We can ensure the items are available when needed to the inventory. Then helps budget and procurement planning. The last one is methods. Regular stock check. In this method, we need to check the regular stock check. Then use inventory software for tracking. Last one is set records levels for supplies.
This inventory is asked for the only 2 mark questions. When they are asking the define inventory, the question is define inventory. You can add the importance and the methods also. It will help to score the more marks in your exams. So these completes our 2 chapters today.
These are the main topics including the 4th and 7th units.
For more notes, you can check in the Nursing Guru app. It is available. More notes is available in our Nursing Guru app.
In that we studied Unit 4 Communication and Nurse-Patient Relationships. Main topic we are studied communication levels, elements and process, types, modes, factors influencing communication, methods of effective communication or therapeutic communication techniques, barriers to effective communication or non-therapeutic communication technique, professional communication, helping relationships in the nurse-patient relationship, purpose and phases, communicating effectively with patient, family and team members. Last topic, maintaining effective human relations and communication with vulnerable groups like children, women, physically and mentally challenged and elderly. These are the main topic today we discussed under the communication and nurse-patient relationship unit 4.
So more updates and more classes you can subscribe our YouTube channel.